Okay, so after leaving Mr. McGowan's room, I would perform hand hygiene, and then I would document. From further findings, I found that his pupils are 5 centimeters in diameter. He seems to be alert and oriented times 3. His mucous membranes are moist and pink. I didn't see any signs of jugular vein distension. His arms and hands were warm to touch. His capillary refill was less than 3 seconds. The skin turgor happened to snap back rapidly. There was no edema present. His IV was dry and intact, and it was dripping normally, and it seemed to be taped in place. His hand grip was strong and equal bilaterally. His radial pulse was equal +2 bilaterally. He had clear lung sounds. Respirations were found easy without dyspnea. His apical pulse was 72. His S1 and S2 were separate and distinct. He was able to turn without help. His abdomen was rounded. He had bowel sounds present in all 4 quadrants. He had mentioned his last bowel movement was last night. He has no issues with voiding and no pain, no discomfort. His legs didn't show any signs of discoloration. There was no edema present. His ankles were pale. Capillary refill was less than 3 seconds. His pedal pulses were palpated and seemed to be equal bilaterally. His foot pushes were also equal and strong bilaterally. And Mr. McGowan was very pleasant. He seemed to be very alert. He cooperated well. His color was normal. His speech was also clear and seemed to be moving and functioning normal.